background noise and allow it to be optimal sound and clarity for our speakers today. So our itinerary for today, we've got a pretty exciting afternoon. I'm pretty excited about it. First of all, I'll get to introduce you to the Board of Directors for LAM. A little side note, you may notice that LAM is often referred to as LAM versus Lymphedema Association, just a little bit easier to say. So if you hear that, just know what we're talking about. And so after our introductions, we're going to have Dr. Leslyn Keith present our key topic today. That'll be followed by a panel of professionals that are going to be answering questions that have been submitted. Some of these questions have been submitted previously, and others, if you have questions as the afternoon goes on, please feel free to send them in. There's a little chat button at the bottom of your screen that you're going to see. So just push on that button and type in your questions, and we'll do our best to answer them. If we don't get to answer them today, we're going to still try to get them answered, probably just by email. So we will try to take care of each one if possible. Alrighty, so who is LAM or what is LAM? We're a patient-focused nonprofit organization that is run by a group of volunteers who are in pursuit of resources, information, education, awareness, and support for those affected with lymphedema, both primary and secondary lymphedema, and just to help improve their lives. This takes a large team of people, and a team that includes family, friends, healthcare professionals, and just even general public that we'll talk about a little bit later on as well, on how they have participated in this event. So today's hard work has been compliments of an amazing board that we work with, and so it is my privilege to introduce to them. So to start off with is myself, Linda Menzies. I'm the president of LAM, and we'll also try to be your host today with the help of a few other of the board members. Susan Stratford, she's a past president. She's been instrumental in many of the things that have happened and the growth that we've seen. Isabel Thorvaldson, she's a vice president, and she's the chair of the Public Relations Committee. Adrian Pearson, she's our secretary and professional advisory chair. We have Ace Zhao, he's a communications chair. Claire-Anne Dayton-Lamy, she's our treasurer. Sherida Olson, she chairs the fundraising committee. And last but not least, we have Ron Wirt, who's in charge of our membership committee. So as a board, we meet once a month, and we usually try to meet in person. Lately, it's been through Zoom. Actually, I guess for the last year, it's been through Zoom, and that's been all right. We're all volunteers, and we represent both professional healthcare providers in lymphedema and also patients that have either primary or secondary lymphedema. It gives us a well-rounded perspective of this disease. And by the way, we're presently looking for to add 1 or 2 more members. So if you're at all interested, I would encourage you to please connect with us. We would love to get a few more people on board. Just taking a look at the numbers here. So we've got 43. All right, we've got some excellent numbers coming in. That's super exciting. So let's talk a little bit about lymphedema. So what is it? So as the word would suggest, it affects our lymphatic system, and edema, of course, means swelling. So swelling somewhere in the body, that's the cause of the lymphatic system not doing its job properly. And so first of all, the lymphatic system, it's our defense system, right? So anytime there's infection or viruses or disease or pretty much anything that's not healthy to our body, the lymphatic system is responsible to attack those foreign objects and get rid of them. It also cleans our blood and carries it back to the heart by the thoracic duct, and then into the down from the cisterna cauli up to the thoracic duct, and then it's a subclavian vein. So there's 2 kinds of lymphedema. There's primary lymphedema and secondary lymphedema. So when a person is presenting with swelling and we think it's lymphedema, we try to figure out which one does it fall into. Primary lymphedema, it means that there's the system has somehow not developed properly due to either a genetic disposition. This can happen at birth or infancy, and it can also happen later on. It's not always present right from the start. It can show up as late as during puberty. We would call this primary lymphedema precox. And it can happen even later on in their mid-30s, for example, and in which case we would call it primary lymphedema tardum. Secondary lymphedema, which is probably the one that we see a lot more of, which is a cause of the lymphatic system somehow being damaged or strained. And this could be from, and not just from these different things, but it could be from obesity, it's a big one, CVI or chronic venous insufficiency. It could be a damage from cancer, from surgery, radiation, some even damage for, if there's a severe car accident, for example, and there's tissue damage, it would affect the lymphatic system as well, potentially. So either way, lymphedema is a chronic progressive disease. And at the time, we know of no cure for it. It's often presented as swelling in the limbs somewhere or where the lymphatic system is compromised. So with the disease having no cure, it can sometimes be quite disturbing to patients when they've been diagnosed with this. The good news is that there's things that they can do to help out with this. So the first thing I would recommend is get in touch with a certified lymphedema therapist, and they can help you with, educate you in things that you can do to help maintain it or try to control it. We often recommend the gold standard care for lymphedema. So this would include the manual lymphatic drainage, compression bandages, skin care, getting you into a compression garment that's been measured quite precisely, and that's going to be a good fit, and also deciding how much compression level to add to that limb. And then, of course, the exercise program to keep the lymphatics pumping. The muscle contraction itself is a huge component of the lymphatics getting moved. And then the other one is deep diaphragm breathing. It sounds so simple, but often people, they tend to do more thorax breathing. So I would encourage you just to take a deep breath into the gut and get the lymph nodes in the gut moving. You've got hundreds of lymph nodes in the abdominal. So get them helping you. So just by deep breathing, deep relaxed breathing. Another huge component that is vital to keeping your lymph system healthy is keeping a healthy BMI or a healthy body weight. And I believe our special guest today is going to talk more about that. So I'm looking forward to hearing what she has to say about that. Alrighty, so I mentioned earlier that when we deal with something like lymphedema, which is a highly undiagnosed disease, it takes a strong team of people to create a strong mesh of support. So another person that's been instrumental in helping us with lymphedema awareness, especially in Manitoba, is our Honorable Ewasko. He's been with us right from the start and has just been a key player in so many ways. So since our government officially made the proclamation to acknowledge March 6th as Lymphedema Awareness Day in Manitoba, Ewasko has been there and reminding the government every year at this time about the Manitobans that have this disease and the importance of getting education out there to all the people. So without any further ado, I would like to invite Ewasko to give a few words of encouragement to us.
Thank you, President Linda, and hopefully everybody can hear me all right from sunny Beausejour this afternoon. So again, good afternoon, everyone, and on behalf of Premier, the Minister of Health and Seniors Care, along with my colleagues at the Manitoba Legislature, I'd like to thank you for this opportunity to bring greetings at this afternoon's seminar entitled Healthy Lifestyle for Lymphatic and Fat Disorders. I'd like to first acknowledge that we here in Manitoba reside on treaties 1, 2, 3, 4, and 5 lands, which are also the traditional territories of the Anishinaabe, Cree, Ojibwe Cree, Dakota, and Dene peoples, and of course the homeland of the Métis Nation. I know that we would have all liked to be attending in person. As it was already mentioned, we're going to have to get coffee and snacks and all that whilst we're listening to the presenters this afternoon from either our kids or like myself in my office here. But I know that the information that is going to be shared by our guest speakers along with the discussions that will arise, are going to be very informative, as it has been over year after year at the seminar when we've hosted them in Winnipeg. I want to thank the Lymphedema Association of Manitoba, of course, and its board, along with today's guest speakers, Leslyn Keith, Kim Radford, and Karen Dobbin. Hopefully, Karen, I pronounced your last name correctly, and others for sharing with all of us very useful information and insights into the ever-changing field of lymphedema. As many of you know, together we championed the cause way back in 2014, as President Linda had mentioned, and as the MLA, we were able to proclaim March 6th each year as Lymphedema Awareness Day here in Manitoba. Earlier this week, I was able to make a statement to the Manitoba Legislature reminding my colleagues and all Manitobans that today is World Lymphedema Awareness Day and its continued importance in raising public education and awareness of this condition. To this day, I continue to be a supporter of the work done by LAM and wish you all the best during this afternoon's webinar. I'd like to thank you, and again, thank you very much for the opportunity to bring a few greetings today.
All right, thank you so much. So Wayne, you've been there, like you said, right from the start, and I just want to thank you for all the support that you've shown, and really making lymphedema a recognized word and recognized disease by so many more people. And even for allowing Susan Stratford and myself to come and do a presentation at the legislature 2 years ago, I guess now. And what an honor that was, and how receptive your government was to listen to us and actually hearing about the patients that are dealing with this. So thanks to you and your government for continuing to support us. That means a lot to us, and we certainly appreciate it.
Thank you.
Alrighty, so now it is my privilege to introduce you to another one of our amazing board members, Adrienne Pearson. So Adrienne works at the skin and wound specialist at the Seven Oaks Hospital. She's a newer member of our LAM board and is passionate about lymphedema awareness, but best practices, treatments, and wellness promotion. So Adrienne is going to be introducing our other speakers for this afternoon, and so I will let her take over for a while.
Thanks, Linda. A year ago, on this very day, I started my journey to become a lymphedema therapist, and I had Leslyn Keith as my excellent instructor. So this is a special day for me. And following that, and even during the time I was doing my training, all these sort of health restrictions were starting to come about. And it was just a really, just interesting time, but such a rewarding time, and happy to have Leslyn here. I'm going to introduce her. She's a certified lymphedema therapist, and she has a clinical doctorate in occupational therapy with an emphasis on lymphedema and obesity. Dr. Keith has started 4 lymphedema therapy programs in California, including 2 in private practice. In addition to treating lymphedema and other lymphatic disorders, she currently researches, consults, and lectures on lymphedema, lipedema, and obesity nationally. She is the author of the book, The Ketogenic Solution for Lymphatic Disorders, Lose Weight and Dramatically Reduce Lymphatic Swelling, and has written several published articles about the efficacy of a ketogenic diet for lymphatic and fat disorders. Dr. Keith is Director of Research and Board President for the Lipedema Project and an instructor for Klose Training and Consulting. So we thank you for presenting to us today, Leslyn.
Thank you so much, Adrienne. I'm really privileged to be invited to speak for your group. Thank you so much for having me. I'm going to see if I can share my screen and pull my presentation up for you. Here we go. I think we got it working. So, and as Adrienne said, I've been treating lymphatic and fat disorders for over 20 years. And in the last 10 years, I've been particularly involved in lifestyle change and most notably nutrition and how that in fact impacts lymphatic disorders. So I'm going to be talking about all kinds of lifestyle factors, but one of which is going to be nutrition. But hopefully this can help anybody who has a lymphatic or fat disorder, help you to better manage your condition. So, and I think you already talked about my disclosures, my program, and my book. So I'll move on with that. So in preparing for this talk, I looked at what is out there in the literature. What is its kind of accepted practice? What do people say is all part of a healthy lifestyle? And I think the number one thing has got to be what you eat, because you do that every time, every day, sometimes quite often every day. So that's the one thing that I'm looking at, and it definitely is out there in the medical literature. And then the next biggest component that I saw mentioned is having that social connection and support, especially when you have a chronic condition. So we're going to be talking about how it's going to best manage your condition by having support from everybody. And then the physical activity and movement is going to be very important. It's definitely mentioned a lot. And interestingly, you might have heard something about this, but this is going to be huge, especially for lymphatic and fat disorders, is having good sleep. So we'll talk about that. It's managing stress, which definitely has an impact. And so what I want to look at here is kind of building that pyramid to the top of the pyramid is going to be that healthy lifestyle, but what is the foundation? What are the things that we really need to work on first? And I think Linda already talked about this. The basic thing that we need to manage a lymphatic or fat disorder is that therapy, the complete decongestive therapy. And we'll talk about each of these things on this pyramid in more detail, but that is really a foundation. We have to have good professional help. But also on that foundation is having nutritional support, having a good diet, and if it is an issue for you, helping you with managing your weight. Then as we're moving up, then you can see how important that community, that psychosocial support is. We'll talk about that in more detail. And then that all part of that is the self-management. When you're talking about a chronic disease, there is a lot that you have to do on a daily basis. And then now, finally, I'm bringing in the physical activity and exercise, because I'm not going to, I usually don't ask my patients to do a whole lot of exercise when they're feeling so bad. We're at the bottom of the pyramid. We need to get them feeling better, and then you feel like exercising. So we're going to build that in actually a little bit later. And then that sleep hygiene, which is going to be huge. And finally, we get to that, that lifestyle plan that is individualized for you. What are going to be those components that are going to work the best for you? So let's look at each of these components. So the first is, as Linda talked about, that complete decongestive therapy. So, and as she already described, that we have those components of manual lymph drainage, that very gentle massage that reroutes the fluid out of the area that you have swollen into an area that is healthy and can accept that fluid. That's probably usually people's most favorite part of the therapy. They love that part. But then, believe it or not, the compression bandaging, applying those bandages actually does make you feel better. It feels annoying and uncomfortable as far as it's bulky and it might get in your way of your daily activities, but during that intensive phase, which is usually less than a month, having those compression bandages is the gold standard, and that is going to help you reduce your swelling the best. And then there will be some mild exercises you do, just moving your joints through their range of motion to help pump that fluid out. And of course, we have to take meticulous care of your skin, because we don't want to have an infection. We want to make sure those bandages are not irritating you. And so and you really have to have this whole program. You can't go to your therapist and say, I just really want to have just the massage part. I don't really rather not do the rest of it, because it doesn't work. You need that whole program. So then the next thing we're going to look at is nutrition. And this is the way that I found that seems to work the best for a variety of disorders, but particularly for lymphatic and fat disorders. And that's ketogenic way of eating. And it's just a whole food, real food diet. There is, as you can see, these are all foods that are on a ketogenic diet. they don't look unusual. These are foods that you see and probably eat all the time. But it has some guidelines, and the most major thing is carbohydrate restriction. And so you're going to keep the carbohydrates low, and then you're going to eat healthy fats. And we don't have to, as in for managing an epileptic disorder, you don't have to have super high fat. You're just going to eat fats as they come with your food, and to help with satiation. So you don't have to force yourself to eat a whole lot of fat. And then you're going to have moderate protein. We need that for good, strong bones and muscle. So we got to have a certain amount of protein. Let's look at a little bit more detail with the foods that are in this way of eating. The base of the ketogenic pyramid is going to be with those healthy fats and proteins, picking the ones that you like, picking the ones that you would be satisfied eating. So it might be fatty fish, meats, poultry, and there's several plant-based healthy fats like coconut, avocado, olive oil. So you're picking the ones that you like. And then the middle of the pyramid is really supplementing with those non-starchy vegetables. And then you also see there you're going to have dairy if you tolerate it, and eggs. So the starchy vegetables like potatoes and carrots, we don't have that because that's increasing your carb level. But the non-starchy ones that are usually more fibrous, those are the ones we're going to include. And then the very top, we're having those treats. And that is nuts and seeds and low glycemic fruits like berries. So that's in a nutshell, that is a ketogenic way of eating. So the next part, believe it or not, that's part of nutritional support and weight management is actually emotion management, because we have been conditioned to use carbohydrates, all those comfort foods, sweets and things that are made with sugar and flour, to manage our emotions. So if we're feeling stressed out, we're having a candy bar. So we're having those high carbohydrate foods. And actually you can see in this image of the brain that sugar will stimulate the same part of the brain as cocaine. So it is highly addictive. It's hard to get off of sugar and starch. And so then I already talked about those stress eating and comfort foods when you're having depressed or stressed out. Typically we're reaching for food to make us feel better, at least temporarily. So what I'd like you to do is think about food and eating as, is this an emotional event or is it a nutritional event? Are you actually hungry, or are you trying to make yourself feel better because something stressful has happened? So training ourselves to be able to deal with our emotions, to manage our emotions with something that's non-food is going to help you as this lifestyle change. So I just put down a couple of things on here that you might do. I mean, for those of us that have a dog, that's just taking your dog for a walk is a really nice one to do that can help you manage your emotions. So think of those things that you enjoy, that you would like to do, that will help you do that. So it's instead of reaching for something to eat. So next, we're moving up that pyramid, and we're going to talk about psychosocial support and making those social connections, because you shouldn't have to be in this alone. You want to be able to manage your condition, and you're going to use it with the help of others and not doing it alone. So that could be a support group. Right now, a lot of it is online. So as you're doing right now, it might be a support group for if you're a cancer survivor. It might be, as this group is, it focuses on lymphatic and fat disorders. It might be you might join a weight management group, or it could just be a healthy lifestyle, a wellness group. So a variety of focuses. For those of you that are use social media, that can also be a really valuable source of support. Definitely special interest groups. And this is, I'm thinking outside of the lymphedema and the lipedema world, but maybe if you're into genealogy, you're joining a genealogy group. It is that making those social connections with with whatever your special interest is. So it doesn't have to always be surrounding your health. And then coming to wonderful educational events like this, you're able to use the chat and you can be connecting with other people. This is a great place to make social connections. So let's talk about all that support that you're going to need for self-care, for managing your lymphedema or lipedema. I was recently at a presentation where they were talking about, you know, of course you have your specialists and stuff like that are helping you with your condition, but over 70% of your time is you taking care of this condition. And so that is what you don't want to do alone. So what people can help you with this? And is it going to be a family member or some caregiver? Is it going to be a paid person who's coming in, either with a home health agency where you have professionals, or just a paid caregiver that knows what your routine is and is going to help you get those stockings on, check your skin, stuff like that. And then when you do go in for therapy and you have that intensive treatment that lasts a couple weeks, you're not done with your contact with your therapist. We want to be in contact with them ongoing. And so you're going to be making sure you have scheduled follow-up visits, checking in every 3-6 months, or at least once a year. You're checking in to make sure that everything is still being well managed. So that's someone who's on your team who's helping to make sure that you've got things managed. Do I need to add something else to my home program? What do I need to do? And that usually your lymphedema therapist is the one who's going to help refer you to specialists. He or she, along with your primary care physician, is going to be one of the best people that is going to know, okay, it's time to see a podiatrist, or maybe we need to see an orthopedic surgeon. So they're going to be able to help you with those referrals. And then looking for all those resources you have in your community, as we already talked about, those support groups and those educational opportunities. So build your team. Build your tribe, your community that's going to help you with this, so you don't have to do it all alone. So we're moving on up the pyramid, and we're going to talk about sleep, because this is huge. And what is so interesting about sleep is it is absolutely necessary for brain health. What happens when we go to sleep is that our brain tissue actually shrinks a little bit. That allows our lymphatic vessels that are just recently been discovered that serve the brain. The lymphatic vessels expand and take up that space. And this is the time they're cleaning out all that debris in the brain. They're making a huge link between getting adequate sleep and Alzheimer's, because we need this time to be able to get out the toxins and the debris out of our brain. So that's only one of many reasons that it's super important, and this is directly linked to our lymphatics, is that we need that sleep so that we can have time to clean up the brain. If you're having trouble managing your weight, there is a huge correlation between poor sleep and having difficulty losing weight. So consider that also. And then when you have poor sleep, you are at a higher risk for all kinds of other chronic conditions. It can increase your risk for cardiovascular disease, for diabetes, high blood pressure, all kinds of other things that you will be at risk for when you don't have good sleep. And then of course, we know that if you're getting poor sleep and you are driving, you are at a higher risk for having a motor vehicle accident. You're at a higher risk for falling. And a lot of us, as we get older, that's our biggest fear, is falling. And then, and other trauma and accidents. You have a higher propensity for having those things happen when you're not getting good sleep. So one of the biggest reasons for poor sleep is actually sleep apnea, and there's a lot of undiagnosed sleep apnea out there. So let's just look at the signs of sleep apnea and see if you think you have any of these. Have you been told that you snore, that you have loud snoring? Do you wake up gasping for air? I mean, I have sleep apnea myself, and I used to have these dreams where I was underwater and I kept waiting to get to the surface of the water, and then finally I would come to the surface and I would wake up gasping for air. So do you wake up with your mouth dry? So that means that a lot of times because you're snoring, you have a dry mouth. Having a headache every morning is quite often you're not getting enough oxygen as you're sleeping. If you're waking repeatedly at night, you can't stay asleep, that may be an indication of sleep apnea. If you fall asleep at the drop of a hat during the day, that also can be an indication. And difficulty paying attention and irritability. So now you think, okay, I have a couple of these signs. I'm thinking this might or might not be an issue. What should I do next? So the next step is that you need to see a sleep specialist. And that might be in your area, it might be your primary care physician, or at least your primary care could refer you to whoever is a sleep specialist in your community. It might be a pulmonologist, or it might be a neurologist. So that next step is to get that referral to that person who can adequately evaluate you. And a lot of times what they're going to do to evaluate you is to have a sleep study. So, and this can be either be done, you go to a sleep center and they hook you up with all the stuff and monitor you as you sleep, or it might be able to be done in your home. Having done 2 sleep studies in a center and not sleeping at all, I definitely prefer the in-home way. Definitely, I felt like I got more, better, accurate evaluation that way, but see what is covered as far as your insurance or your health care, and can it be done at the home, or does it need to be done in a center, and see what works for you. And then if you do have sleep apnea, of course, then the traditional treatment is going to be, one treatment could be getting a CPAP. Okay, so a continuous pressure, something, so it's continuous air. That's what it is, continuous air pressure. So it's pumping air in there to keep your airway open so that you get enough air and you stay asleep and you get better sleep. It has pretty miraculous. So consider that. So let's look at the next thing that might be impacting our lymphatic health and our ability to manage our condition. And so another part of our healthy lifestyle is managing our stress. And so some of the biggest stressors is time management. Everything seems to take longer than you expected, than you planned for, and now you're rushing around, you're behind schedule, you're late, and that is very stressful. So being able to say, no, I'm only going to have 1 appointment instead of 4 appointments today, in order to be able to manage your time better and then avoid that stress may help. And then as an occupational therapist, I like to look at what's called role balance versus role overload. So role balance means that you have a good balance between taking care of yourself, taking care of others, different roles that you may have as a family member or as a worker, or as someone who enjoys different types of recreation. You have a balance between all those parts of your life versus role overload. I mean, are you someone who is working 75 hours a week? Are you someone who is always the caregiver and never being cared for? So we want to have that balance and not that overload, because that will create stress. And then lastly, I read an article that said that these were the most common things that cause stress, and it's always about health, finances, relationships, or some kind of trauma in your life. And sometimes, I mean, you can't avoid these things, so I'm not saying that you want to avoid them, but it's our response to them. How do we handle those? And sometimes we need help to be able to handle those things. Again, don't go it alone. And the impact of stress has huge health implications. So it can change your appetite. Some people will eat and some people will not eat at all. It definitely, we can experience that increased anxiety and depression, mood swings, decreased sex drive, Impaired immune response, which is huge for someone with an impaired lymphatic system. So this is really important to manage our stress, to keep our ability to avoid getting ill better. And then we really have impaired memory and learning can affect stress, can cause those outcomes as well. What can we do for some stress relief? Sometimes it's tough. So I give you this photo of a place that I used to live, moved away from last year. This is beautiful Estero Bay in California, and you could tell a very peaceful setting, wonderful place to live. So something to help is to set those boundaries, and that gets to role overload. When you're the person that everybody comes to and asks you to take care of something and you just do it, you need to set those boundaries, because you can't do it all and also take care of yourself. Being willing to ask for help. I know that a lot of us are used to being the one who helps, and it's hard for us to ask for that help, but getting that social support will help. Exercise, interestingly, is a good stress reducer. So even if that exercise is just going for a walk or doing exercise sitting in a chair or in your pool. So it doesn't have to be super strenuous exercise, but sometimes just that movement will help reduce your stress. And a lot of you may already know some good relaxation techniques, you know, doing a Tai Chi or meditation, or I think that it was Linda who mentioned this, deep breathing exercises. Great for stress reduction, and it also helps our lymphatics. Think about limiting your caffeine intake. So I'll tell you anecdotally, in my practice, my patients who reduced their caffeine actually had better response to treatment, and the swelling went down when we kind of hit a plateau, and then they stopped drinking, you know, so many cups of coffee every day. All of a sudden we started getting a reduction in their swelling. But just as far as stress goes, that caffeine can increase your heartbeat and your irritability. So thinking about reducing that, even if you don't totally eliminate it, we really want to get that better sleep. That's going to help reduce your stress. And trying to find your why. What is meaningful to you? Being engaged in those activities that give you purpose, that give you enjoyment in life. So find what is meaningful to you, and being able to engage in that is going to help reduce your stress. And lastly, just trying to increase that positive emotion. If you find you're around people who have a lot of negativity or that your response to them is negative, you know, you try to spend more time around those positive people and the people that cause you to experience more positive emotions, and that's going to be a great stress reducer as well. So the dreaded physical activity. Let's talk about what we want to do to enhance our lymphatic function and all the benefits of physical activity. So it lowers our blood pressure. If any of you are experiencing hypertension, this could help. It definitely is going to maintain and build muscle mass, which is wonderful for a variety of reasons, but as we get older, it will prevent you, it will make you less likely to fall, and that's huge. Reducing stress and enhancing mood, as we already talked about, improving the sleep, as we talked about, and it actually, you know, it will increase your energy level. You will be a little bit more mentally alert. It's very interesting, as you think that, you know, doing some exercise would tire you out, but it actually makes you feel more energized. And then lastly, and mostly important for our lymphatic system, is when we have that muscle contraction, it's going to help move that lymph through our lymphatic system and enhance that ability to keep the swollen area better managed. Give you a picture here. I'm in a pool because that's one of the best places for someone to be who has swelling, is to be in the pool, particularly standing up, being in that vertical position because the pressure of the water is more down at your feet and less pressure as we get up to the surface of the pool. So that is actually pushing the fluid in the right direction where we want to go. So, but looking at that form of exercise, that type of activity that is going to be most pleasurable to you, or at least the one, as one of my colleagues said, the one that you hate the least. So doing strength and resistance training could be doing weights, or it could be just doing a resistance band. It's something that is going to keep those muscles pumping and strong. Or it could be just gentle movements and stretching. It could be yoga. It could be yoga in a chair. So what is the activity that's going to work for you? And then some things that are going to help you engage in getting more movement into your day is, would it help if you exercise with a buddy? If you had a plan that you're going to meet somebody on a regular basis to go on a walk, then you're more likely to do it. If we spend money by joining a class or joining a gym, we're more likely to do it because we wanted to get our money's worth. So that might be when the gyms and everything and the classes start opening up again, that might be something to do. I know right now I'm taking a yoga class online. It's through a Zoom meeting. So this might still be something that you could do by joining some kind of community program, but you're just going to do it online. And then, do you like exercising alone, or does it work better for you to be in a group? Does it motivate you to be in a group? So see what's best for you. And then lastly, do you want to have a specific time that you're, because you're in that class or whatever, or do you just want to build this into your daily activities? You're parking further away from the store and having to walk in the store. Maybe you're not using that motorized chair once you're in the store, but you're walking all the aisles. So seeing how you can just increase activity in your daily activities, increase movement. I have some people that, as they're doing the dishes, they're standing at the sink, they're doing heel raises. So how can I just get more movement in my daily activities? So now you're ready to put together your personal lifestyle plan. And it's very personal. It needs to be tailored to whatever your needs are. So your plan is not going to be the same as, your neighbor's plan or a family member's plan. It needs to be tailored specifically to what your needs are. And it should be a collaboration between you and your team, the team that you assembled. So it's not anyone telling you this is what you're going to do, but you're working with them as discussion to figure out what is going to be the best for you. And interestingly, having it be a challenge, having you need to put some effort into it actually makes it improves your confidence on your ability to do it. It makes it more satisfying when you achieve that change. So it's not going to be as effective if it is something just super easy. So if you put some effort into this, it actually will have a bigger impact on you. And then, as we already talked before about, finding that purpose, why would you want to change your lifestyle if you kind of like how things are now? But if you have a reason for wanting to do that, you want to live a healthy, pleasant life long enough to see your grandchild, graduate from college. So you have that why, that purpose that will actually give you more motivation for actually changing your lifestyle. I want to show you some people that with lymphatic and fat disorders that have changed their lifestyle. This one, Kathy, I've presented on her in several presentations because she had multiple areas that she changed her lifestyle. She did use a ketogenic diet, but she also eventually added exercise in there. And so she changed a bunch of things. She, worked on her stress and her sleep and all kinds of stuff. And so she had quite an impact on her. She started out at 321 pounds. And then here she is. And, you know, I tell you how many pounds she lost, which was remarkable in itself, but she had lots of other things that happened. She was taking 15 medications and now she's down to 5. She has more energy. She has improved fitness level. Her swelling, of course, decreased so much. She has to get new garments, not because they're worn out. It's because the swelling has decreased so much, their size has changed, that she had to get new garments more rapidly than they were wearing out. And then her blood panel, so the lipid panel and her A1C and all those various markers that we have for health all improved. And she had quite severe pain, and the pain is very much reduced. So the impact on her was huge. And let's look at Kelly also, who I've presented on quite a bit. And you look at Kelly and you would actually think that he was obese. As a matter of fact, that's what he was diagnosed with, was obesity. But actually he went through a procedure for reflux that they injected a polymer that was supposed to go into his esophagus and instead went into his thoracic duct. So it went throughout his lymphatic system and it caused swelling throughout his trunk, his head, neck, and both his arm and legs. And so here he is after making lifestyle change. He did very specific things with his diet, with breathing, which Linda talked about, with exercise and all kinds of stuff. And he was able to get that change. So he had a lot of pain, and that decreased. His breathing really improved. He was on oxygen and using a CPAP. He doesn't have to do that anymore. His swelling, as you can see, was very much reduced. He has increased energy, and actually even increased bowel function because of all that swelling in his trunk. It affected his intestines and all that kind of stuff. And he did lose quite a bit of weight as well, but the weight was fluid. And here is another person. She's actually presented with me at the National Lymphedema Network Conference. And so Mindy had, what she found out was lipedema, and she also had some swelling as well. And here she is after changing her lifestyle. And just an incredible change. And interestingly enough, she had 20 migraines a month. And ever since she did this lifestyle change, she doesn't have any migraines at all. Her polycystic ovarian syndrome is better managed. Her blood pressure is decreased. Her swelling is down. She was saying that she hadn't been able to wear her wedding ring in a couple of decades, and now it goes onto her finger. And then, of course, she also had quite a bit of weight loss. So it can be done. These people were not well. They had a hard time until they made these lifestyle changes. And it's not that they just were able to adopt the lifestyle changes easily. It definitely was effort-based and a challenge for them. I wanted to show you this one patient because she actually did not need to lose any weight. Kind of like Kelly, it's just she has swelling in the one leg because of cancer treatment. And she thought, well, can I, what will happen if I use a ketogenic diet because I don't need to lose weight? Well, it's not just for losing weight. As you can see, this is only after 45 days of using that and nothing else different in her treatment for her condition, but she was able to reduce that swelling quite a bit just in a month and a half of changing her diet. Now we got to work on other lifestyle changes as well. I wanted to tell you about that we have a virtual conference coming up in April, the Ketogenic Solution for Lipedema and Lymphedema mini symposium that's going to be on April 17. And I do have, it's also right here listed on here. If you just Google Ketogenic Solution for Lipedema, you will come up with our registration page for more information, but also check out my website, leslynkeith.com, where I talk a lot about diet and lymphatic disorders. And then there is a couple of, if you guys are hooked up with LEARN, which is the Lymphatic Education and Research Network, they have a lot of free videos of presentations by a variety of healthcare providers. I just told you about two of them, Dr. Eric Westman and myself, who have given talks specifically about nutrition. But there's a lot of great presentations on this website. So I would definitely check out the Lymphatic Network. Lymphaticnetwork.org is their website. And then Lipedema Simplified is specifically if you are interested in a variety of innovative treatments for lipedema. This specifically is talking about keto, but we do a lot of stuff for lipedema. And then a couple of Facebook groups. One is for lymphedema, keto and fasting for lymphedema. And then we have our keto way of eating for lipedema Facebook group. These are private groups that you have to be allowed into. So just a few resources for you that I hope you avail yourself of. I do give you my email right here, so be sure to email me if you would like to talk or have any questions, because I always enjoy talking about this stuff. Thank you so much for having me today, and I look forward to questions.
Thank you, Leslyn. That was great as always. And yeah, I think we can all, whether we have lymphedema, lipedema, or even just in our daily lives, I think we can all benefit from the wellness information that you gave us about healthy lifestyle. And I know for myself, I'm going to be thinking more about my brain health and sleep. So thank you for that. Good reminders all around. And we thank you for that. If viewers have questions, please put them in the chat. I know one came in that I am going to ask right away of you, Leslyn. And it was regarding the case you showed with Kathy. And someone asked, what kind of edema diagnosis does she have? Could you comment?
Yes, she has lipolymphedema, meaning that she has lipedema and lymphedema. So both legs were quite swollen. And it included swelling to the dorsum of her feet, so the top of her feet, which typically with lipedema by itself, you're not seeing any swelling at the ankles and the foot. Yeah.
Okay, great. Well, thank you. So as I mentioned, just if people have other questions, type them in the chat and we'll see if we can get to some of them. We're going to move on to our second portion of the event. We're going to do a bit of a Q&A panel. So we're pleased to offer this Q&A panel we have Leslyn joining us today. We also have Karen Dobbin and we have Kim Radford joining us. So in way of introductions, Kim Radford has a Bachelor of Exercise and Sports Science from the U of M. She's after following this, she's certified as an athletic therapist, and Kim currently resides in Winnipeg with her 2 daughters. In 2004, Kim began working at Diamond Athletic Medical Supplies, where she expanded her knowledge in home healthcare and orthopedic bracing. She has 13 years plus of experience as a certified custom fitter, and she's continued to learn and grow in the field of custom garments and lymphedema. Kim attends many conferences across Canada to maintain and keep current with the ever-changing field of lymphedema. And so we want to welcome Kim. And Karen has been a physiotherapist for over 35 years and a lymphedema certified therapist for 11 years. She has a Bachelor of Medical Rehabilitation in Physiotherapy and a Master's of Science in Rehabilitation, She has training in acupuncture, cancer rehabilitation, exercise management, myofascial interventions, and advanced lymphedema management. So currently she provides physiotherapy and lymphedema management in a private practice clinic and at Cancer Care Manitoba. She's a clinical instructor and senior fieldwork educator at the U of M and the College of Rehab Sciences. Karen has special interest in cancer rehabilitation and lymphedema management. She's a 12-year breast cancer survivor. She's passionate in helping people gain an optimal quality of life no matter what their diagnosis, but especially for those recovering from cancer. So we welcome Karen as well. So I'm going to start opening up the questions for the panel members today. So I'll start with Karen. We had some pre-submitted questions, and I'm going to start with Karen. So Karen, in your studies, would you say that arm lymphedema clients and leg lymphedema clients are treated the same?
There's actually no real difference in the actual management of lymphedema, whether it's upper extremity or lower extremity. First of all, can everyone hear me okay?
Yeah.
Yes, okay. There's no difference in the actual complete decongestive therapy that's done for upper versus lower. There are, obviously some maybe differences in some of the sequence and direction of when you're doing manual lymphatic drainage, upper extremity versus lower extremity. But for both areas, it includes the manual lymphatic drainage, it includes compression bandaging and garments, it includes exercise, and of course, skin care. And in early stages, certainly things like elevation are important, either for the arms or the legs. The real differences I see as a physiotherapist and lymphedema therapist is often function. And unfortunately with the legs, you can often get a much higher rate of impaired function with legs, just because sometimes they can get so big and it's going to affect people's mobility, people's ability to do stairs, even self-care, walking, all those kind of things. So I see that more often with larger legs than I do with arms. I mean, obviously you can get some impaired function with your arms as well. So that's sort of a big difference I see with leg lymphedema. And the other thing I think with leg lymphedema is the wearing of sometimes clothes and shoes. It's much more difficult when you have larger legs. I mean, obviously, if you have large arms, you're going to have trouble with shirts and so forth and blouses and that kind of thing. The other difference I see is that I believe sometimes lower extremity swelling can affect your ability to work sometimes more than the arms. It does depend on your work, but I think for lower extremity swelling, you may have more difficulty with transportation possibly, or, going in and out of the workplace, or, physical type of work if you have a very physical job. I think for upper extremity swelling, it might be more of a limitation if you're at a computer all day. Or sometimes, maybe you are doing some physical work, some lifting and things like that. So there's definitely differences like that. So much depends on the stage of your lymphedema. I also think regarding, if you're doing your own self wrapping and, the donning of your garments, that does tend to be a challenge with the lower extremity for the reason that sometimes it's hard to reach harder to reach your feet sometimes. And for upper extremity, it's hard to bandage one arm, because you can only use one arm and you have to bandage the other arm. So there's challenges for both areas. So, there's those kind of differences. I hope that answered the question.
Thank you very much. It sure does. I'm going to go over to Kim now. Kim Radford, we're wondering, when ordering compression garments, are there certain companies that are better for certain patients? Examples are for wearability, comfort, and style, and availability.
Yeah, so I would say all the compression companies will have similar options in regards to style and fabric. Cost can definitely play a factor in choosing the appropriate garment. Some companies will have a base price for their garment, and then they'll charge extra for their added on features. And these added on features help to make the garment fit a little bit better, be a little bit more comfortable. So those include like silicone band, it can include closed toe versus open toe, different waistbands for pantyhose. And then some companies, they don't add on for these specific features. So cost can definitely be a factor in choosing the garment. Also, there's lots of different color options. Some companies will have a wide variety. Some will just kind of have your basic colors. There's even some that have prints in the fabrics. Warranty, most companies will have some form of warranty, but there's anywhere from 30 days to 45 days. And that's for like a sure fit warranty, make sure the garment fits properly. So if somebody is traveling or they're more rural, then we do try to make sure we have that full length of time for warranty, which can sometimes help with fitting the garment. And then time frame. We found with most of the companies, it can take anywhere from 1 to 3 weeks to get the garment in. This is probably the most important, especially if you're dealing with a customer's first garment. We want to make sure that, that we're going to get it in a timely manner. So we'll often try to choose a company that we know we can get the garment in a little bit quicker for their first garment. And then for their second, third garment, yeah, maybe they go with a print that may take a little bit longer or different material. But yeah.
Thank you. Our next question is for Leslyn. You already talked about diet quite a bit, Leslyn, and the ketogenic way of eating. The question here we have is, would you suggest a different diet for lymphedema versus lipedema patients? And I know I saw you had different Facebook groups as well. Mm-hmm. And so I'm also wondering that.
Yeah, great question. You know, right now there is a Juzo Power Symposium. They're having their conference going on right now. And as well as another big nutrition conference in South Africa is happening right now. Everybody's doing everything virtually. And I got the same exact question about that because, I mean, really, I mean, you would think that maybe these are completely different disorders versus lipedema and lymphedema. Should it be managed differently? And what I've been finding, and this is totally anecdotal because we don't have studies for sure to tell us for sure, but it seems like doing a fair amount of carbohydrate restriction and limiting yourself to just healthy fats, so you know, avoiding those margarines and Criscos and stuff like that, seems to work the best. And it's we have animal studies that show that it works the best, and we have one very small study with women with lipedema. There was just 9 participants in the study, and they used this ketogenic way of eating in that study, and they had you know, remarkable reduction in lower body fat and pain, which is pretty exceptional. So, but we don't have a lot on people with lymphedema. So we have a lot of animal studies where they're looking at the ketones seem to benefit the lymphatics, and removal of the carbohydrates reduces inflammation, which benefits the lymphatics. But we don't have, you know, a lot of evidence right now. It's pretty much clinical experience, and I would say that it's going to be the same way, same kind of diet for both.
Okay, great, thank you. Our next question is for Kim again. Do you recommend using a compression pump?
That's, I feel like if I was asked that question maybe 10 years ago, my answer would have been no. Probably I didn't know much about the compression pumps. They've definitely come a long way, and there definitely is a place for them in lymphedema treatment. I mean, they should also be used in combination with manual lymph drainage and self-massage, compression garments, diet, and proper exercise. But if you consider people who are living rurally, they may not have options to get to see a manual lymph drainage therapist regularly, or they may not have anyone who could provide a Coban wrap, which is a compression wrap for them. So this would be a great option for them. We at Diamond Athletics, we deal with the biocompression system. So this system applies a gradient sequential pressure distally to proximally, so similar to how compression garments work. They have multi-chambers, and then they have some pretty wide range of sizes, as well as some custom options available. They also have some unique garments. So they have a 16-chamber pants, which will provide compression basically all the way up onto the lower body and help to get some harder to treat areas such as the groin, the buttocks, and the abdomen. And then they also have one called the BioVest, and it's 8 chamber for the arm, and it helps to encompass the arm, the shoulder, the chest, and the axilla, which also can be some areas that are harder to treat. So I'd say definitely a place for treating with lymphedema.
Do you have any idea how much a pump might cost offhand?
You know, unfortunately, I don't. No, sorry.
Probably expensive.
Do you want me to say?
Sure. If you have any info, Leslyn, that'd be great.
So really want to get this covered by your insurance because they could be quite expensive. I mean, you could find something online that is not a good device for a couple $100s. But if you want to get a really good device like what Kim described to really work well to manage your lymphedema, it's going to be around anywhere from $1,500 to $3,000. If you get the really high
US
end,
prices.
What? Oh,
US
yes, US prices. Yes, thank you very much. That's US dollars. And if you get the really high-end device, the FlexiTouch can be up to around $10,000 US dollars. So this is something that really should be covered by, you know, your healthcare system or your insurance.
I'm going to move on to Karen on the same topic, but I'll start off with a question from the chat. Someone's asking, do the pumps work for both lymphedema and lipedema?
I'm not the best person to ask on that. I don't use pumps a lot.
Okay.
I don't know if Leslyn can answer that.
Sure. Yeah, I do use pumps quite a bit. And definitely for lymphedema, and it's best if you have any congestion in your trunk at all, or if the swelling goes all the way up to your groin or goes up to your right up to your shoulder, it's really good to have something that works on the trunk as well, so it'll mimic what your therapist is doing. And if you can't get that, because quite often to have that trunk attachment costs and you have to pay for it yourself, then you need to have the training on how to do the self massage as you're using the pump. For lipedema, there's a little bit of controversy with using the pump for lipedema because there is some who believe there really isn't a lot of fluid volume with lipedema, but the pump is useful for more than just moving fluid out of the limb. And particularly with lipedema, if we have a lot of fibrosis in the tissue, it can help reduce that fibrosis, that stiff, thick, hard feeling. And it also seems to really help with the pain with lipedema. So I would say that it's something worth exploring for lipedema, but if you have any swelling associated with either lipedema or lymphedema, then it definitely could be something that you should definitely explore. And this should be explored with your doctor and your lymphedema therapist. It's not something you would go out and get on your own.
Yeah, for sure. I think that's wise advice. Did you have anything else to add, Karen, on the topic of pumps? Regarding, you know, if you prescribe them for patients or what you use to determine how you might suggest someone get a pump?
Well, I absolutely agree with what Kim was saying. I do believe it can be an adjunct to, you know, proper complete decongestive therapy. But if someone does not have access, then it's better than not doing anything, right? So if people live out of town, or maybe functionally they can't do their own self-MLD or bandaging or that kind of thing. So using the pump is better than not having anything. So it can certainly be an addition or sometimes a sole treatment, but certainly an addition. So if someone has a pump and they use it on a regular basis, it's actually adding to the reduction in their swelling or the management of the swelling. And generally it should not be a replacement for manual lymphatic massage or wearing of your garments or exercising. You don't just put the pump on and forget everything else necessarily. But the big thing here is the cost of it. Like in Canada, and maybe some insurance companies cover the cost of the pumps. And and all the, you know, attachments and so forth. But it's, as we all know, it's not covered by our Manitoba Health, like by the government. So it's a huge expense, and you know, some people just can't afford that. So, but you know, I will recommend pumps if someone has the financial means for it, and if they, you know, want to add that to their management, I think it can work.
Okay, thanks, panel. Kim, I've got another question for you. What garment or support options could be used for lymphedema management when wrapping is not an option and treatment is cost prohibitive? So we've talked about pumps, but is there anything else that you might suggest when people come into the shop?
Yeah, definitely. So we get a lot of people coming into Diamond Athletics before they've had any type of reduction. So we kind of give them the basics on first letting them understand the gold standard of manual lymph drainage and bandaging. But then we also let them know about Coban wrapping. And for those who don't know, Coban is a 2-layer bandage system. It's disposable. It can last up to 7 days, but it's typically replaced twice a week. And it would be applied through your home care. So we do have a number that we give them for the people who are in Winnipeg. For those people who are not, we tell them to get in contact with their family doctor or with home care or an access center in the area. But this would be covered through their regional health. So definitely a more affordable way to have reduction of fluid. And then the other option would be any of the Velcro wrap systems out there. So most of the compression companies have their own Velcro wrap. These can be worn overnight. They can allow for up to a 20% reduction within the same size. They're easier to don by the person themselves. So that would be an option too. I mean, they can be a little expensive, but they do have a wide range of off-the-shelf sizes. So for the most part, people do fit into their off-the-shelf size range.
Okay, thank you. Karen, we're wondering what the best approach for post-orthopedic surgery lymphedema management is.
Well, it's much the same as any other lymphedema management, but there are certainly some considerations, special considerations. First, you do need to consider where is the swelling. Obviously, it's usually around, you know, if it's surgery, you know, maybe a knee joint replacement, it'll be around the knee. Sometimes it's distal to that. You have to, you know where what surgery it is and the injury that was involved possibly. Sometimes it's not always just surgery. You want to know if, well, were the lymph nodes traumatized? Were some removed or some lymph vessels traumatized? And also you want to know about the surgical site. Is it healing or healed? And also, has the swelling been there, you know, is it just post-op and it's resolving, or is it something that's been several months? So those are some things to consider, but many different surgeries can benefit from lymphatic management. You know, of course, your total hip and total knee replacements, even some, you know, upper body surgeries like carpal tunnel surgery. It could be, you know, a trigger finger surgery. It can sometimes be shoulder joint replacements, and for sure lower extremity, and not just surgeries. It can sometimes be, some people have a really severe ankle fracture, or they might have, you know, a pelvic fracture or something like that. So it's not just always surgeries. So really, it's the same kind of management as you would treat any other lymphedema. And for sure, people that have knee joint replacements, let's say, that have existing lymphedema, that's somebody that needs to be definitely managed for their swelling after their surgeries. And so it would be much the same. The goals are, of course, to manage the swelling, reduce the swelling, getting the person doing their exercises, watching their skin, and, you know, sometimes getting into compression earlier than, if they already have the lymphedema, they might have already compression garments, and they can maybe get into those, or maybe have to have new compression garments. So the goals absolutely are not only to reduce the swelling, but also increase their function, get in that back, walking, stairs, those kind of things. Maybe if they, need to put shoes on, if it's an ankle in surgery or something, they maybe need to reduce that swelling so they can get back into shoes and all those kind of things. So there's a wide range of goals, but also obviously it has to be patient-centered. What is the patient's goal? Maybe their goal is to walk their dog or something like that. So you have to take that in consideration. So absolutely, postoperative swelling can be managed in the same way that we manage any type of lymphedema. But it has to be obviously specific to the patient and what type of surgery they had. I'll give you one quick example of an orthopedic treatment patient I treated. He had a severe accident on his bicycle, went head over heels on a vehicle, and had a severe fracture to his pelvis. And he had to have open reduction and internal fixation to the multiple pelvic bones. And he was actually seeing a colleague of mine for physiotherapy. And so he's postoperative, and the physiotherapist came to talk to me. He says, "Karen, I think this guy has swelling or lymphedema." And the patient was told, "Oh, it's just postoperative swelling." This guy had swelling to his entire left leg, which is not postoperative swelling. And he was not a prior lymphedema patient. He was very fit and so forth. He did not have postoperative swelling, only maybe initially he did. Anyway, I did some full manual lymphatic drainage. I did compression bandaging, and we got him into garment. He was, of course, doing lots of postoperative exercises already. I just saw him actually this past week, and I remeasured him. He lost 58% of his edema volume in that leg. He had a fabulous response to treatment, and he's in his garment. He loves his garment. He wears it. So he's been very good patient, because he's followed through on everything. He did his self-massage, his own wrapping. He wears his garment, does all his exercises. So he's had a fabulous response. And he was a postoperative edema. And unfortunately, the surgeon did not recognize the lymphedema. The surgeon was only concerned about his surgical technique, and that everything was solid from the surgical side point or view point. But he didn't really look at his leg or worry about his swelling. And unfortunately, that's what we see a lot of times with a lot of our surgeons, especially, is that they don't look outside of their surgery. Anyway, but this guy did very, very well, and he was a really good example of some postoperative edema that I treated, and very successful results.
Great. Well, thank you, Karen. We're just going to wrap up here in a few minutes. I have one more question for Leslyn. Can urine change color with lymphatic drainage?
Yes, definitely. It definitely can. And this is one thing that if you've had manual lymph drainage before, your therapist might have told you, please have something to drink afterwards, replenish that, because you're actually moving stuff out, and the materials that are in your tissues that have moved out and gotten to your bladder, they might have been stuff that's been stagnant for some time if your swelling has been there for a while. And so you can have a difference in color and odor to your urine. So don't be alarmed. You might actually, if you've had the swelling for a long time and then you finally get some treatment, you can also feel slightly nauseous and unwell with your first couple treatments. And of course, you could actually have the flu or something, so we don't want you to ignore those symptoms. But a lot of times, you can have that experience with the initial treatments of it changing your urine, feeling some lassitude and feeling slightly unwell. Drink lots of water, rest, and that should resolve within a day or two. Of course, if it doesn't, we always got to pay attention to those symptoms.
Okay. Well, thank you. That's all the time we have for our Q&A panel. We're so pleased and honored to have you all. And I'm going to pass it off to Linda to do closing remarks.
Alrighty. Thank you so much, Adrienne. And thank you to Dr. Keith for an awesome presentation. Just learned so much. Lymphedema is one of those things that the more I learn, the more I know, the more I realize I don't know. So definitely just lots of learning still to do, and the research that's out there is just phenomenal. So we're looking forward to more of that as well. Our panelists, thank you so much for your information and sharing your knowledge. Each of you has been an integral part to so many of our patients in Manitoba. So on behalf of them, thank you for sharing with them and also with us today. We mentioned kind of throughout our afternoon about the team it takes to show support. So another amazing team player is Amanda Sobey. Now she's been an inspiration to, I can't even tell you how many, but I would guess to say hundreds, maybe even thousands of people. And she is, she's an inspiration because she herself has lymphedema, but you would never guess by looking at her. She's super active. And she doesn't miss a beat. So what she's done, just to kind of go that extra mile, which is all what Amanda often does, is she actually got legislature to actually have the legislative building light up in teal. So teal, as a lot of you will know, is a symbolic color for lymphedema. So it's going to be glowing in teal this evening. So that's going to be kind of pretty cool. There is a gathering, team gathering that is meeting there this evening at 7. Now, please know that masks will be required and social distancing will be required as well. So if you want to meet and show support for each other, that will be this evening at 7 o'clock. And so thanks, Amanda, for doing that. So there's a few other people that I want to, or organizations that I want to say a big thank you to. One is the Winnipeg Free Press that have done a couple of articles in their newspaper for us, the Winkler Morton Voice and Selkirk newspaper and Pembina Valley Online. These have all been organizations that have supported us with excellent stories, with excellent publicity to make people aware of lymphedema. And personally, I've seen some really good responses just from their support that they've shown. So we're getting close to the 2:30 mark. So before I close, I just want to encourage each one of you to make sure that you register to become a member of LAM. And if you are a member already, then please renew and try to get this done before March 30th. We've got some pretty good prizes that are available. So we're doing this membership drive. And again, talk about community support. This is all about the team that we keep talking about. So I'll just see if I can find these prizes here. Okay, oh my goodness, you guys, like we have such an excellent community. We've got 2 $100 gift cards, and also there are 7 home and garden package prizes to be won. And this is if you register before March 30th. And I'd just like to add that on top of that, these incredible prizes that you have a chance to win, there's also, just by becoming a member, it's only $25 for general public, $95 if you're a professional, but you get free webinars like this. You get a subscription to a very informative lymphedema magazine called Pathways. It's a national magazine. You get documents on, you get discounts on certain events. You get invites to different fundraisers that we've had. So in the past, we've had different events going to soccer games, baseball games, a wine tasting event, different things like that. Plus, you get some amazing support from your association. And if there's and we also have a 50-50 draw. So again, just go to our website and see if you can get linked up to that. That would be another awesome way to just have a little perk connected to us. And then, yeah, just visit our website, lymphmanitoba.ca. We've got some great information on there. If you are looking for a certified lymphedema therapist, again, we have as many as I know of mentioned on our website. So just go to our therapist and you'll see the drop-down menu, and you can click on that to see if where the closest lymphedema therapist is that is close to your home. If you have any other questions, please reach out to us, and we look forward to seeing each of you again. So is there anything else, Adrian or Claire-Anne, that you want to add?
There is an email going out to all LAM members today. You might have even gotten it already, just talking about the raffle and directing you to our LAM website. So thanks again, everyone, and we hope to see you at another event soon. Bye.
Okay, bye everyone. Thanks for your questions.